They say they exercise religiously, but the unwanted fat just wouldn't come off.
So a mother and daughter turned to liposuction, and they say they're thrilled with the results. Dr. Ian Smith joins us now with information about these dual surgeries.
That's right, Linda and Glenn. Well, everyone else, happy Mother's Day. It's a trend that many doctors have been noticing the last few years. Couples, whether husband and wife or mother and daughter, are undergoing cosmetic procedures together. The aesthetic results may not be any different, but having someone go through it with you could do wonders for the soul. Rose Paris and her daughter Catalina are not only tied by their mother-daughter bond, but one that's, well, let's say, a little more personal. The two went to the same plastic surgeon and had some refinements done. Catalina was first to get rid of her unwanted fat.
I do a lot of working out. I work out 4 to 5 days a week, and there's some areas, no matter how much you work out, it just doesn't go away. So I wanted to get rid of a little bit on my thighs, and my inner thighs, and my outer thighs.
Then it was Mother Rose's turn.
I saw the dramatic change that she had shown her body, and since I had a little bit of rolls, and I was also exercising, and they were just not going anywhere, so I said, why not?
So Rose took a little out of her back and the sides of her abdomen. Liposuction, while certainly not the most dangerous of procedures, can have its complications. It helps to have support from friends and loved ones, but what better support can you ask for than from someone who's had it before or who is your mother or daughter?
Because she went through it, and she was very supportive. And being she's much younger than I am, and I saw how well she did, I felt that it's very, very good for a mother and daughter to do this together.
But it's important not to expect the other person's results.
You have to look at your own preoperative photos and where you came from and who you are and what you look like now. You can't compare your body to somebody else who had the same procedure.
The warmer temperatures and the sunny days tend to drive people out of their homes and to the beach for a day of relaxation. And it's about this time of the year that many doctors who perform cosmetic procedures say they know an increase in the number of people coming through their doors looking to make those tiny improvements. Doctors attribute this trend to several factors.
The techniques themselves have gotten better. They're safer, they involve less scarring, the recovery is easier, and aesthetic techniques in the last decade have gotten much better so that now you can have a procedure and be much less likely to have a prolonged recovery. It's just easier to have things done.
And doctors caution that these procedures shouldn't be taken too lightly. There are potential complications.
You have to have realistic patient expectations, because if you don't, you're going to have an unhappy patient. And you also should never allow a patient to try to have you do more than you think is possible, because if you do, you're going to run into side effects and complications.
But that's not the plan of Rose and Catalina Paris. This Mother's Day, they'll be talking about the normal things mothers and daughters talk about, as well as sharing a bit of vanity. It's so important to remember that cosmetic procedures are elective surgeries. Be sure that it's something you really want to do, and if there are any reasons why you shouldn't have the procedure done, don't force the issue. Also, make sure you choose to alter the body in moderation. Doing too much greatly increases the risk for complications.
Keep it simple.
That's right, just a little tweak here, tweak there, but
Refinements, as you called it.
Very important at this time of year, too, as you point out. Thank you.
All right.